Virus COVID-19, including Grenada's response to the threat of the virus, all right? And of course, we have a panel in studio to help us make sense of the issue. To my left is Health Minister Nickolas Steele, and next to him is Acting Chief Medical Officer Dr. Francis Martin. Dr. Martin, good to see you. Welcome.
It's good to be here.
All right. So, gentlemen, thanks again for coming on at this time. Right. So we have quite a bit to talk about. And I also want to let you know that live via Skype is Dr. Joy St. John. She is the Executive Director of the Caribbean Public Health Agency, CARAPHA, based in Trinidad and Tobago. Dr. St. John, good evening to you.
How are you?
I'm very well. Thank you so much. All right, so here's what's going to happen. We'll have a conversation, first of all, with Dr. St. John, because she has to leave us in a while, after which we will come back to studio and, of course, continue the conversation with Health Minister Nickolas Steele and Acting Chief Medical Officer Dr. Francis Martin. But for now, let's go to Skype and chat there with Dr. St. John. And Dr. St. John, what I want to ask you, first of all, is the region's risk level relative to COVID-19 and how vulnerable we are as a region.
So CARAPHA's risk assessment is that the risk to the region is low, largely based on a few issues. One, there's multiple screening before persons from China get here. There are no direct commercial flights from China. There are port health measures in place, so when someone comes to designated ports of entry, there is detection. And a very big important thing is that we have no reported confirmed cases of COVID-19. I need to say that again. There are no reported confirmed cases of COVID-19. But things are moving rapidly. This is the most rapidly evolving outbreak that I have seen in my 26-year career in public health. And so we're monitoring very closely to see if we need to change the risk level to moderate.
Right. And Dr. St. John, what will influence you changing the risk level for the region?
The main thing that would influence me would be if we have an importation of a case. Now, there are 3 stages. The preparedness phase that we're currently in. If there's an importation of a case, that means someone comes into one of our territories and they prove to be positive for COVID-19. And then if there is established person-to-person transmission within one of the countries or more than one of the countries in the Caribbean. So once we have an importation, the risk changes.
Okay, all right, I follow you there. And relative to testing for COVID-19, because I understand that is under the purview of CARAPHA, right, relative to regional testing. Trying to understand the process. Explain the process relative to testing for us.
So CARAPHA is the reference laboratory for many tests. We have accredited laboratories for medical microbiology, for drug quality testing, and also for environmental testing. For COVID-19, CARAPHA does have testing capacity. The Pan American Health Organization has given several countries kits and training. Not all of the countries are up and running, but other countries have the capacity. So CARAPHA has been testing for well over a week now, going into 2 weeks. So the countries that have capacity are testing for themselves.
And the countries that have capacity, countries such as?
So I will name countries, but I'm not sure if they're up and running. as far as I know, Barbados, Guyana, Suriname, Belize, Haiti, Dominica, Jamaica. Did I name 8?
I don't think you have.
Let me count again.
Okay, go ahead.
Barbados, Dominica, Jamaica, Haiti, Guyana, Suriname, Belize. I think I've caught most of them.
Okay.
But I'm not sure how many are up and running.
Okay, so you just counted 7 there for us.
The 8th is Trinidad.
Trinidad 8. Okay. So obviously Grenada is not on the list.
CARAPHA is testing within Trinidad, but I think there's another country. I would have to go to check the letter that was sent to CARICOM by PAHO.
Okay, so Dr. St. John, Grenada is not on the list, right, at the moment. So it means Grenada does not have the capacity to test. Can you confirm that?
Well, PAHO is the one that's done the choice of countries. So I can't presume to say who they selected or why.
Okay, all right, I follow. Right, there are some myths concerning COVID-19. What do you say, or what would you say stands out as one of the myths regarding COVID-19?
I have so much to choose from. It has been, in fact, the greater risk and threat to the Caribbean is the viral misinformation, miscommunication, fake news, rumor mongering, and fear mongering. There are all sorts of things. So let me start. There was one going around, I hope it's not going around still, that the coronavirus is nothing new. There was pointing to as they have coronavirus. So you have to know that the coronavirus is a family and COVID-19 is a new member of the family. There is no known treatment, although they are testing different cocktails. There are no vaccines for COVID-19. So even if coronavirus is on bleach or Lysol, it's not going to affect this particular member of the family. And people were actually purporting that if you drank or inhaled bleach or Lysol, you would be fine. That is dangerous. It could kill you. Then there is the myth that it doesn't like heat, so it's not going to survive in the Caribbean. Let me tell you, one of the hottest countries in the world, Egypt, there has been a case identified in Egypt. So please don't take on that type of rumor. The other thing is that it doesn't like alcohol, so if you drink a lot of rum, you'll be fine. No, you'll get alcohol poisoning before it stops COVID from affecting you. Then there have been several rumors about people coming to actually affect countries and cause COVID-19 transmission. That's another myth. Then there have been several pieces of fake news, and they're very well crafted. They are put together in a way so it seems as if this is really true about outbreaks of the disease, several cases in more than one country in the Caribbean. This just drives fear and terror into our citizens, and it may turn away our tourists, upon whom many of our countries depend for our economic and financial stability. So many persons have had to refute rumors. There's also been targeting of certain hotels, saying that they have brought persons in that have COVID-19. All of these scaremongering and fake news, I would really like it to stop.
Okay, very well. And before we let you go, Is CARAPHA providing training support to the individual countries relative to rolling out their respective protocols for handling passengers coming from airlines, cruise ships, that sort of thing?
So CARAPHA has been producing every 2 days situation reports. We're up to situation report 12, where we give an update on all that is happening globally and regionally of note. We have also been producing guidance documents, carefully adapted for the Caribbean situation on many of the issues that you have outlined. We have held sessions with the chief medical officers. We convened the regional coordination mechanism on health security. We have also had individual sessions with chief medical officers on this issue of supporting them with their decision making in taking cruise ships based on the level of disease in guidelines based on the CDC standards. And we have also been interfacing with other sectors. For example, I had a session with customs and immigration heads of the Caribbean. So apart from just producing documents, we've been having sessions with many of the sectors, as well as, of course, our main target for the health response of any coordinated Caribbean response, which would be the ministries of health.
Okay, all right, very well indeed. Well, thank you very much, Dr. Joy St. John, Executive Director of the Caribbean Public Health Agency, CARAPHA, based in Trinidad and Tobago. Thank you so much. Thank you, really appreciate that.
Thank you.
Yes, all right. So you are watching Beyond the Headlines. We are talking the very latest on COVID-19, including Grenada's response thus far to the threat of the virus reaching our shores. We're going to take a break, and when we come back, we of course will begin the conversation with the officials in studio, Health Minister Nickolas Steele and Acting Chief Medical Officer Dr. Francis Martin. We want to know the Grenada response at the moment to what's happening. Stay with us, we'll be right back.
Choose my toilet paper, made right here in the Isle of Spice. Cherish space off Harbor Bay, super value every day. The price is right and locally they're made. Support local when you purchase Cherish and other quality brands from Grenada Paper Products.
Because your vehicle is a necessity, being roadworthy is critical. Hubbard's Motor Department introduces its new tire and battery sales and service outlet located at Building Supplies Compound in Grand Anse, close to the Sugar Mill Roundabout. Available are a wide range of competitively priced tires, maintenance-free batteries, oils and lubricants. Keeping in mind your busy schedule, this outlet is equipped to provide you with fast and reliable service. Simply drive in and you'll be delighted with your service experience. For more information, contact 440-2087. Hubbard's, quality service, affordable prices.
Use clay, it washing cleaner than ever. Oh mama, oi, oh mama, oi, in every household must have it, oi. Highly effective, stain removal, lemon freshness, antibacterial washing powder, fresh and clean, fresh and clean. When I put on me clothes, me must win. When I wash me clothes, no other detergent could ever wash me clothes like this.
Now buy 3 bottles of Clay's dishwashing liquid for only $8. Available at Best for Less Supermarket, Eat Fresh Supermarket, MNC Jones Supermarket, Home Pride Supermarket, The Food Fairs, Caranage and Grand Anse, Roberts Enterprise, Springs Food Mart, and Charlo Supermarket.
other Place products available: hand sanitizer, fabric softener, hand washing liquid, dishwashing liquid, and toilet cleaners. Distributed by Fortune Foods Company Limited, Tempe St. George.
Welcome back. You are watching Beyond the Headlines. Kenroy, Baptiste, and Ford at Campbell. We are talking Grenada's response now to COVID-19. We have quite a bit to talk about. Live in studio, Health Minister Nickolas Steele. Next to him is Acting Chief Medical Officer Dr. Francis Martin. Gentlemen, good to see both of you again. Welcome.
Good night to you, and good night to all of our viewers and listeners out there.
Right. So we got the regional perspective from Dr. Joy St. John a while ago. We now want to know the Grenada response to what is happening, because this is a very serious issue at hand. Let's look at the very core, if you will, of Grenada's response to the threat of the virus at the moment. Where are we right now?
Well, I will let Dr. Martin answer that as he is the Chief Medical Officer, and I'll come in at,
Yes, absolutely.
At the end. Yes.
Dr. Martin.
All right, well, where we are at the moment is based on the current risk that we are assessed, and Dr. St. John indicated that the risk for us here in the region is low. And so this has informed what we do. We, of course, made sure that we have our complete plan in place. This is something that is not new. This is old. We do have a pandemic plan, so it's just a matter of reactivating what we've had, and that placed us in a very good position. But the fact of the matter is our response was guided by 4 strategic lines, and most of what we did fell within those 4 strategic lines. The first of all is robust public education and awareness. We have engaged in a number of activities, including this one tonight, which speaks to the idea of public education and awareness. And I must say that when we envisioned putting this plan together in the past to deal with H1N1, we didn't anticipate that the public awareness needed to be so robust, and this is the first time we actually have to deal with this misinformation, both internationally and locally and regionally. And to my mind, resources that should be put into actual response, now that resources been put into communications and misinformation, and it's a waste of resources if you ask me, but you know, this is the nature of the world we're living at this point in time. So education was a major part of it. We produced lots of flyers, videos put together by Mr. Kevin Frederick, our PR officer, and distribute those as widely as possible. Still much more to be done, and we, by any stretch of the imagination, we're not finished with this, but the fact is education is important. The second one that was important for us is surveillance and monitoring. And again, this goes right in line with what the CARAPHA is suggesting to us. You must improve your ability to see, look, and what's going on. So on a surveillance part of things, we have decided to meet among ourselves and engage important stakeholders. And the Airport Authority was a major stakeholder in our surveillance. Customs and immigration, very important for us. To be able to have the proper surveillance, we needed to make sure that we have advanced passenger listing in terms of immigration to be able to assess and gauge your risk based on the travelers that you have coming in. Monitor
so specifically the flight history and all of that stuff.
Yes, flight history, flight schedule at the beginning of the week, and each day, each flight, we ensure that we get the passenger listing, so we know who is sitting where, their travel history, and that gives us an idea as to what our response should be on the ground. In terms of monitoring, we have improved and upgrade our ability to scan at the airport, our ability to identify patients with fevers, and so we've installed a second scanner. And ensure that we monitor, and as the program goes along, we'll get more and more into this. Building partnership and relationships was very important for us as a strategy as well, because you do know we have risks on the island. We do have an international medical school. We do have open borders, tourists, and so it's important that we engage Post Authority, engage SGU, engage our partners within the island that impacts on health. That we have done. Again, more is to be done, but we really figured that this is a strategy that we need to go. The last strategic line we've taken is to target or is to focus on our target population. From the epidemiology so far, it seemed that the age group that most could risk is elderly and people with comorbid conditions like chronic diseases. We have recognized as being a major issue, and we have begun engaging them. Tomorrow, I'm anticipating a very lively discussion with the GARP, the Association of Retired Personnel. I did one last week. It was really, really useful. People were really receptive to it, and looking forward to another one tomorrow in Grenville, where I'll be engaging that sector of the population because we know that they are more at risk. So this basically sums up our discussion going forward, and we look forward to giving more information as the night progresses.
All right. So I want to understand now the specific protocol being followed when a flight touches down at Maurice Bishop International Airport. How is that flight treated, for example?
Right. Well, the treatment of a flight started long before the flight actually got here. The treatment of the flight starts at the middle of up in the week when we get the schedule of flights. We look at where they're coming from and we identify our risks there. We further tighten that response by looking at the advanced passenger listing. And so we gauge what has to happen. So if we figure that a flight is a risk flight and that it's possible that there might be someone on board, we will know where that person is sitting. When that flight lands, the very first person to approach that flight would be our port health officer, an airport port health officer, which is something that we should have been doing a long time before, but we are now able to do this, where the port health officer goes, and the port health officer would receive the aircraft health declaration form. On that form would be listed any health activities or health risks that are on that plane. And in the event that we already know someone is on that flight that is a person of interest, then a decision is made whether that person should come up first if they're sitting at the back or come up last, depending on where they're sitting. And how we treat with the people around that individual is also considered. Does that individual have a mask on? Does that individual have a fever? Is there a cough? Is there a sneezing? The absence of those, we treat differently. If the traveler of interest has these, there's a separate protocol that we follow. So there's algorithms for everything that happens, but it starts, what is triggered out is start based on what happens on the plane at that point in time. A passenger of interest comes off that plane, that passenger is not allowed to go through the normal immigration direction. They're taken to a separate route, a separate location, where they're are looked at and screened by the nurses, the temperature is taken. We ask some more probing questions to identify the level of risk we're dealing with. Their baggages are handled differently. Their passports are handled differently. If that passenger continues to be a passenger of interest, that passenger will now be taken to the isolation unit that is stationed on the airport. And they'll be there until we have arranged and organized for quarantine for that person. If that person has symptoms, however, they will be taken to the isolation unit within the hospital setting where they'll be treated until they recover.
Okay, all right. Okay, Mr. C, you wanted to talk a bit about the protocol?
No, just to say that these protocols have been in place. Yes, we have personally made sure that not only the protocols have been implemented, but that we have increased the level of due diligence, and we've improved on those protocols, and we continue to. In fact, our epidemiologist, Dr. Sean Charles, is currently in Trinidad at CARAPHA, meeting with Dr. St. John today and tomorrow to deal with the improvement of that. What I want to discuss, though, is that a significant amount of our efforts, unnecessarily, a significant amount of our efforts are being spent on dealing with false news, disinformation, and purposeful and, to a point, malicious intent to malign or to discredit the health personnel here in Grenada, and we see it in the region as a whole. And that is new. That is why we have to adjust our protocols, in that this is not the first virus. The team that's here didn't start the job yesterday. We have been dealing with this. We've been dealing with H1N1. We've been dealing with Ebola. We've been dealing with MERS. We've been dealing with all of the other threats that exist. What is new this time around is a level of disinformation and the amount of time that we have to spend in the Ministry of Health to tell the public what is true and what is not true.
Okay, so the coronavirus, a family of viruses, but COVID-19 is a new strain, all right? So it is new to our part of the world. Okay, all right. So let's get to talk now about quarantine issues, right? How many individuals have been quarantined in Grenada?
To date, 4 persons have been quarantined.
Well, now, as we speak, 3.
3, because one has since been released.
Since spent their 14 days.
Okay,
yes.
and that's the student from a student from China.
They're all students from China.
Right.
Yeah, one of them is a Grenadian national.
Yes, one is a Grenadian.
Okay, right. How long was he quarantined for, the one who has since been released?
14 days.
14 days.
Yes, he was released last weekend.
How long is the incubation period for the virus?
Well, the incubation period is still part of what is being studied, but out of the abundance of caution, 2 weeks seems to be the period, because some of the research coming from some part of the world indicated that the incubation could be between 2 and maybe 9 days, and then there's another part of the world that says it might be between 9 and 14. So we just figured just cover the entire period. 2 weeks.
And there's also another school of thought that is saying it could be up to 24.
Well, no, that's misinterpretation again, false information.
That all comes back to, like I said, the amount of time we're spending to speak about what's right and what's wrong. I mean, if individuals want to second guess us, I understand that, but they can look at all of the other international news and see that all of the other first world nations, everybody else, is still following on the same 14 days.
Well, I mean, to be fair to some of the callers, at one program I did earlier, many of the callers indicated that they heard that news from the BBC, so they thought it was a credible source. What happened, though, is that the individuals didn't take the time to actually look and discuss what was actually being discussed at the time. It was not a situation where they were saying there is no idea that it's 24 hours. It was a case that occurred, one case, where someone showed up 24 days later. And in further discussion, the idea was, is it possible that that person got reinfected? Just as when you have the flu or the cold, because remember, coronavirus is a cold, it's a flu virus. You know, we get the cold and it lasts for 5 to 7 days, and a few days later you get a second cold. And this is something that happens in virology and happens in the case of coronavirus, that the discussion around that particular situation was that it may have been a reinfection.
So can COVID-19 present that similar challenge of reinfection?
Right, this is why the discussion and the research is ongoing, because it may be possible. That is what they're saying.
May be possible.
Yeah.
The operative word may. Okay. All right. So now that this particular man has been released from quarantine, what happens next?
He carries on life as normal.
So he's totally free to continue his operation as an individual? Okay.
Yes.
Right. And what is now the status of those who are in quarantine at the moment?
Well, I'm really happy to say that I've just released the second person in quarantine tonight.
Tonight?
Yeah, tonight.
So that's another one. So you will talk about, so two will be left.
Are left.
Right.
Within the next few days, yes.
Right. So the fact that you quarantined all 4 to begin with, what sorts of signs were being shown or symptoms?
Well, first of all, I have to give kudos to those individuals who allow themselves to be quarantined. I mean, they made our job so much easy for us. There was never a pushback, there was never a fight. These individuals understood the need and the reason for what they were doing, and they were extremely cooperative. Communicate with me on WhatsApp every day. The issue was, we need to observe them to make sure that they don't develop a fever, and of course don't develop a cough or a sneezing or any upper respiratory tract symptoms. Those are what we were actually looking for. So that is what we actually looked for. And interestingly, while we were discussing releasing those guys, somebody told us the discussion was, we really should think of having a psychologist or something on our team, because the psychological stability of the persons being quarantined is not an easy thing to stay in one place for a very long time. And so that part, while our first two guys, they seem to be in great mind and great spirit, I think is a credible thought going forward, that maybe they do need some sort of a psychological support going through this.
Yeah, I think I want to touch on that as well. In that, that's why I made it a point to be there at the airport when we knew these individuals were coming in. One, I wanted to make sure that all of our systems were working properly, but also wanted to make sure that these kids were treated properly, that they saw individuals, and that's why we also insisted, Dr. Martin was there himself, all of our senior team was there to meet these individuals, to make sure. I was there as well on the tarmac to let them know, one, first and foremost, to welcome them home. You're home. You have made it all the way home. Right. We are here to welcome you, however, out of an abundance of caution. And let me stress on that again and repeat it, out of an abundance of caution, we are going to ask you to spend 14 days in quarantine. We are going to make sure that those 14 days are comfortable, that we, personally, Dr. Martin was checking on these individuals twice, 3 times a day. He was bringing food for them. Right. Making sure, whatever you want, place an order, delivery, to make sure that they were well looked after as well. And I think that's what we need to look at. With all of the negatives that are going around there, we need to make sure that we remove the stigma. While we respect and acknowledge, and I will be the first to defend, our freedom of speech. Our freedom of speech does not allow us to have a freedom of discrimination. This outbreak is not based on any nationality. It occurred in one particular country, China. It started in China. In 2009, there was another coronavirus outbreak that started in the United States. The difference between the 2009 outbreak and the 2019 outbreak is basically social media. There were no flights that were stopped. There were no travel restrictions. There was not the hype. There was no individuals on social media losing it live to everybody, and that being shared as opposed to facts being shared. That's the difference between the last outbreak and this outbreak. Okay. And more people died at the last outbreak than this outbreak. But it is just in the information, or as Dr. St. John said from CARAPHA, the disinformation is the difference this time around.
Yeah. Admittedly, there is a lot of disinformation, and we really need to dispel a lot of that. All right, let me ask you this, though. You have since met with parents of students studying in China, right?
Well, the government met. I did not personally meet. No.
I want to talk about you. I talk specifically the government.
We have.
The government, all right? So I want to get some feedback on what was the agenda of that conversation with the parents, and what's their mood, that sort of thing, relative to their children.
It was a discussion led by Foreign Affairs. It's to reach out to the parents first and foremost, because we've been in constant contact with the students through our ambassador and our PS of Foreign Affairs, and the entire Foreign Affairs ministry has been putting all of their resources there. But it's to meet with the parents and hear them and hear what their concerns were, and also to try and alleviate any of their concerns.
Yeah. I mean,
Dr. Martin, you were there, so you can fill in some of the blanks there.
When we were told that we were scheduled to meet with the parents, I was worried.
Why were you worried?
Because because what I expect, But the first thing that struck me was the sheer numbers of students we have over in China. I didn't realize we have so many students over there. There was quite a number of mothers, parents, fathers, and so on, and relatives. And the first thing that struck me was the mood of the parents. They were not angry. They were not upset. They all seemed to understand what was happening. And while everyone would like to have their loved ones home, when we explained to them the risks they're taking of having to bring their children home, the mothers were very happy with the decisions that were taken. Of course, the major issue for the students were, it seems to have been the food issue. I remember our first quarantine guy, when we released him, we asked him, about his experience of what bothers him most. And again, for him, food was an issue. So I'm really pleased to see that we paid so much attention to making sure he was fed well while he was here. He was requesting things like oil down and hurricane ice cream.
Yes, I imagine.
I felt like I was shopping for my son. But yeah, the mothers, the parents were really gracious. And I left there feeling really comfortable that we were doing the right thing and that wisdom is actually prevailing.
What were the concerns, though?
The concerns was mostly having the children have enough supplies so that they can eat well. And the other one was boredom, interestingly. And so they encouraged one another to spend more time on the phones with their children because the kids were in one place at one time, and after a while, things really do get a bit bored. So that was the two most concerns they had.
Right, okay. We need to take a break at this time. You are watching Beyond the Headlines. We're talking, of course, Grenada's response to COVID-19. Still to come, we will talk a bit more on the individuals who are like the frontline workers, right, at the airports, and relative to the training that is being rolled out for them to deal with the situation, right? And of course, we will discuss some other issues relative to your trip to CARAPHA. Dr. Martin, we want to talk about that as well, all part of measures being rolled out. Stay with us, we'll be right back.
More reasons to play this game. More money for way. Super 6 a bigger jackpot game.
Now you love Super 6 even more. With more money.
The jackpot galore.
Play more.
Win more. Have more fun.
With more jackpot money.
Super 6 is my number one.
With the new and improved Super 6 team, the jackpot keep growing and growing.
And growing.
More jackpot money. More reasons to play this game. More money for way. Super 6 a bigger jackpot game. Super 6. Bigger jackpots. More chances to win.
Good evening and welcome back. It's time for the National Lottery Authority's Lotto Draw number 3062 for this evening, Monday the 17th of February 2020. The estimated jackpot for this evening, $134,000. Well, joining me once again is Ms. Josephine Clark. She's representing PKF Accountants and Business Advisors. Well, as per usual, let's find out what the free ticket letter will be for this evening. Good luck. And this evening's free ticket letter is, yes, the free ticket letter for this evening is I as in ink. I as in ink. It's time to reveal tonight's 5 winning numbers for $134,000. Good luck. And the first number is... 9. All right, so let's do a quick recap. Check those tickets. Free ticket letter. That letter was I as in ink. That's I as in ink. And the 5 winning numbers for 134,000. First number up was 6. That's 066. The second, 18. 1818. Third number was 25. 2525. The fourth, 21. 2121. And the fifth and final was 909. If you have these numbers, congratulations to you. And of course, if you haven't won this evening, guess what? We're here tomorrow, God's will, so do get your tickets and continue to support sports, culture, and nation building. Have a good night.
More jackpot money, more reasons to play this game. More money for way, Super 6 a bigger jackpot game.
Now you love Super 6 even more.
With more money to the jackpot galore.
Play more, win more.
Have more fun. With more jackpot money, Super 6 is my number one. With the new and improved Super 6 game.
Jackpot keep growing and growing and growing.
More jackpot money, more reasons to play this game. More money for way, Super 6 a bigger jackpot game. Super 6, bigger jackpots, more chances to win.
Inspection and licensing continue. And at Hubbard's, we want you to be ready. From February 16th to March 31st, we're offering vehicle owners with single registration letters 2,501 to 5,000 and plural letters from 251 to 500. It's your turn to get 11% off new Torque tires and Power Max batteries. Don't get caught unprepared. Visit us today at our motor department at Mountgate and the Tire Bay in Grandance, located next to the Hubbard's Building Supplies. Grenada, 1795. One man with a sense of destiny.
Tonight we stand our ground. Tonight we stand on the side of history.
14,000 slaves with a dream and a promise. Julian Fedor, a Heritage Theatre production, written and directed by Chris DeRiggs, 28th and 29th March, 4th and 5th April at the Trade Center.
People was not made to live like this. It's like we have a cause.
Julian Fedor, an action-packed historical drama.
I see blood falling from the sky, falling up that mountain river, flowing from Belvedere Hills. I see blood.
4 big nights of theater, the play the nation has been waiting to see, with Sam Ogilvy, Lisa Grappy James, Robert White, Dale Devine, and other top-of-the-line acting talents. Opening Saturday, 28th March. Get your tickets now.
How going on, boy?
Hey, good old things.
Hey, Daisy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex, or give them a call, 440-1015 or 440-1016. Or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
Make no excuse. Claim those fitness goals with a little help from Quartz. Save big on home fitness equipment when you shop with up to 15% off. Plus, get a chance to win a free spin bike. Shop today and pay nothing until March with Quartz Ready Finance. Make no excuses. Shop and win. Only at Quartz. Bringing value home. Conditions apply.
Welcome back Beyond the Headlines for another Monday. Health Minister Nickolas Steele and Acting Chief Medical Officer Dr. Francis Martin all with me in studio. We're talking Grenada's response to the threat of COVID-19. All right, so I want to go to the Health Minister for the time being. Relative to COVID-19, the death toll in mainland China has reached 1,000 770, with at least 70,548 total cases reported. That to me is quite extensive, but now you're saying during the commercial break that it's a different picture altogether. Please break that down for us.
Yes. I mean, the social media and some of the international news agencies are measuring the total number of cases, as you've just done, and you said 70,000. Of those 70,000, 80% of them have been mild, i.e. a sore throat or mild fever. And also, the majority of those individuals are back out in circulation. The disease, they caught the virus, and their body dealt with the virus, and they're out. They're home. They're comfortable. They're cured, or they're better. What we measure is the number of new cases per day. That lets us know as to whether this disease has broken out or whether it's under control. And what we are seeing consistently, I would say since the 12th of February, actually since the 4th of February, we're seeing a significant decrease day on day in the number of new cases. But if we simply just measure the number of total cases, and it would almost give you the impression that there's 70,000 people sick in hospital in China. That's not the case. There's 70,000 people who have caught the virus since January 23rd to now. But they're out. You're seeing in other countries as well where the disease has broken out, or the virus, sorry, you're seeing individuals that are being released.
Okay.
You're also seeing, unfortunately, in certain countries, a death toll. 1 or 2 individuals who have succumbed to the disease. But there are a couple things that you need to put into perspective, and I need to say this just before I make my final point on this.
Yes. A caller's on the line, so I'll come back to you shortly. 440-1252. Good evening. Welcome to Beyond the Headlines.
And so, good evening.
Yes, you're live. Go ahead with a question or comment.
To me, I think people who were scared had a right to be scared. And perhaps you had a right to alleviate or to prevent them from being too scared. As you know, it's the first time they've been hearing about this particular disease. In fact, I'm asking myself now, when you talk about quarantine, what do you mean? What do you mean? Because maybe it's the first time people hearing people have been quarantined. I don't know. At the same time, I'm asking you, were you scared, or were you able to, were you personally, or you all scared knowing about that for the first time or hearing it? And at the same time, look at, I think 1 or 2 doctors have been diagnosed and 1 or 2 died. Now, being a doctor and having, sorry for saying that, I guess you don't have so much knowledge as the other people abroad in connection with that. Were you yourself scared meeting these people, well, that's for the first time? And are you still scared because you associate with them? Do you have enough mass in Grenada to attend to 40,000 people if they have it? Or do we have the wealth as China to manipulate or to see after these people? That's my concern.
I think
okay, caller, thank you very much.
The caller is raising a point that flows right into what I was about to express also. I mean, in Grenada, we have an area just south of Grand Anne's Beach called Quarantine Point. It's called Quarantine Point because it was a quarantine area for leprosy. So the concept of quarantining individuals when they have a contagious disease is normal. It's a standard procedure. The coronavirus, as I said earlier, in 2009, there was an outbreak. And we dealt with it. The mortality rate on the coronavirus is less than the mortality rate on Zika, on chikungunya,
H1N1,
or H1N1, or the influenza virus. It is less. But because it is new, we all, as a global community, don't want to have a widespread introduction of something new. Whether it is milder, not as fatal as, we don't want, if possible, to introduce something new. And that has been the initial, and that's the reason for the response from the WHO, and that is the way we approach it. So the call is right in terms of people being scared. And I think what caught us off guard, where we as a Ministry of Health in Grenada and in the region, and in most cases in most of the countries internationally, where we dropped the ball is that we did not contemplate the effect of social media, false news, on informing our public. We believe that if we dealt with this outbreak, this corona outbreak, the same way that we dealt with the last corona outbreak, that we would be able to control it, which we are. But the difference between 2009 and now is social media and disinformation. And in the beginning, in the last week of January, into the first 2 weeks of February here in Grenada, we had all over social media individuals who were recording themselves having a temper tantrum, expressing themselves. There is freedom of expression, I respect that. But they were recording themselves having a temper tantrum. That was spreading and not the truth. Now, the person has a right, if they want, to record their temper tantrum and share it with all of their friends. But then we had certain leaders and certain social media bloggers taking that and making that the news, as opposed to contacting Dr. Martin or Dr. Sean Charles or Dr. Joyce St. John and asking them, what are we doing? You have the WHO saying travel bans are not advised, are not effective. You have CARAPHA, Dr. St. John, saying travel bans are not effective. You have Pan American Health Organization saying travel bans are not effective. One of my darkest moments as Minister of Health was having to put a travel restriction, not because it was scientifically rational or made sense or would have prevented or made it harder for the disease to come here. No. We put that travel restriction in to stop the public hysteria, to make the Grenadian people feel more comfortable that we were doing all that was necessary, while we were doing all that was necessary before. We put that simply to quell some of the negatives that were out there.
Okay.
But it still doesn't change the fact that we need to monitor every person coming in. It still doesn't change the fact that we've seen an outbreak to an extent, person to person in Singapore. That we see the UK saying they believe they have an outbreak, they're monitoring person to person. So do we stop that British Airways and Virgin Atlantic and that American airline? No. There are still flights going in to the UK from China, to the US from China, commercial airlines. The commercial airlines that have stopped, the British Airways, the American Airlines, the Air France that have stopped flying, said they did so because their unions insisted that they should not travel. Not that it was science, but it was their employees felt uncomfortable. And again, 2009 to 2019, these airlines didn't stop traveling to the US because there was less of a social media impact. And that is that's the lesson to learn on this outbreak.
Right. Please hold it a thought for the time being. Another caller has come in to us. Hello, good evening.
Good evening, Kenroy. Good evening to the Minister of Health and to Dr. Francis Martin. Just two things quickly. There's a difference between isolation and quarantine. Okay, I know that, but I don't know if really how many people kind of understand the difference in that. No, my question is, if there's cases of, if the quarantine cases becomes cases of whereby they have to be quarantined, have to be isolated, do we have people trained to do security in what will be a contaminated environment? Thank you.
Thank you, caller. Thank you very much.
I'm the layperson in the ministry here too, and I asked my colleague here that same, similar question, slightly different wording. That yes, there is a difference between isolation and quarantine, and for viewers out there, quarantine is when you're asked to just stay in one place and not interact with other people, to see if you become symptomatic, if you begin to have a fever, sore throat, whatever, but you're monitored on a regular basis for the 14-day, in this case, for the 14-day period. Isolation happens when you start to present certain symptoms, and that those symptoms make you now most definitely contagious. So you'll be isolated. But in terms of having people here, I think what we need to reaffirm, tuberculosis is contagious. The systems are in place. Measles is contagious. The systems are in place. Ebola is contagious. The systems are in place. Influenza is contagious. Mumps. All of these contagious diseases that have existed, that we've known, that have been here in Grenada. Chickenpox.
Okay.
They're all contagious, and the healthcare workers are aware of. And there are frontline workers that will deal with it, and then there are others. What we are going to be spending our time and have been spending our time on, because we realize, again, with this social media battle, is to reinforce and reaffirm to our healthcare workers as a whole that a contagious disease is a contagious disease.
Okay. All right. We'll be back with you in a while. Caller 9, good evening.
Hi, good evening, Kenroy. Good evening, Minister Steele, Dr. Martin. I commend the government and the ministry specifically and all that it has been doing in terms of alerting the public and the actions and the preemptive steps that are being taken. However, we have to be careful about not, while it's important that we allay fears and we don't want people to panic unnecessarily, we have to be careful about the facts. Now, Minister Steele said that most of the 70,000 people are okay and they no longer have the disease, they're moving around. This is not the fact. The fact is, of the 73,000 persons who have been affected, only 14,000 have had an outcome, meaning they don't have it anymore. 14,000. But of that 14,000, almost 1,900 have died. So 14,585 had an outcome. They no longer have it. But 1,800 of them, 19 of them, they don't have it anymore because they have died. And this represents 13%. Not 2%, 13% of those who had an outcome. The remaining 50-something thousand still have it. We do not know when it all comes down what the percentage would be.
And it is not appropriate for you to give misinformation.
Okay. One moment. Caller, are you there? Okay, caller since left us.
Right.
Okay.
It is not appropriate for the caller to give misinformation, and we will have to correct the misinformation.
Okay, so what is your response
The
to him?
ability of somebody to call in, because we do have a freedom of speech and we value that, and to quote figures is what has us in the problem that we're at now. That somebody just simply quotes some figures or shares it on social media and we assume that because it's on public television or because it's on Facebook that it's facts. Those are not the facts. Those are not the facts. The death toll with respect to coronavirus is still below 2%. It's still below 2%. What we do recognize, though, the only thing I will give to the caller.
And this information, Minister Steele, is coming from where?
The WHO, and the Chinese themselves, yes. This information is coming from those who are there. In fact, the Chinese government just allowed an international delegation in to assist and to witness and to learn.
And how do you respond to this talk that the Chinese government has not been forthcoming relative to the reality on the ground?
I think that is one of the biggest bits of disinformation. I would categorically say, and it's been said by the Director General of WHO and by others, that no other country in the world could have dealt with this the way the Chinese government has done. No other country in the world has been prepared to do what the People's Republic of China has done in terms of isolating an entire city. Can you imagine in 2009 when there was an coronavirus breakout in California? That's where it started.
I remember that, yes.
Can you imagine the United States isolating the state of California and stopping all Americans, all individuals, Grenadians who might have been studying there as well, all individuals who were in the state of California because there was a breakout in 2009 that they said nobody's leaving? These are the measures that the Chinese people have, and their government have gone to stop it spreading to the rest of the world. This is unprecedented. And this is why I do believe, as governments, as healthcare practitioners, as ministries of health, we need to inform the public of this, the extraordinary measures that have never been done before. Not because this is an outbreak that has never been seen before. Coronavirus, as I say, I will repeat again, in 2009 broke out in the United States. They did not isolate a state and prevent people from traveling. There were no travel restrictions, and there was not the type of hysteria.
Okay.
Doesn't mean that it wasn't more serious. It was actually. The death toll there was far greater to date.
All right. Another caller online. Good evening, Beyond the Headlines.
Hello, good evening.
Yes, caller, you live. Go ahead.
Yeah. So, good night to the panel. I normally, don't call into these programs for, a variety of reasons. But I felt compelled to call in tonight. I am part of medical fraternity, you can say, of sorts. And I was calling in regards to the previous caller, the comment he made in regards to the outcomes and 14% of the people who died. I believe that particular caller was being disingenuous when he was presenting the facts, because he failed to note the fact that of that 14%, the persons who succumbed to the disease already had pre-existing conditions.
Yes, I was about to raise that point, Minister Steele.
Such as possibly congestive heart failure or cancer, who already had weakened immunity, and having an onslaught of this new disease that the immune system has not seen contributed to their demise. It wasn't young, healthy individuals who had no coexisting conditions, or your average person who was in well enough health. It was the elderly persons with diseases. So to present the information in such a manner, I believe, or it seems to me, was with a motive of spreading misinformation, to present the information in a way that could suit their own agenda.
Okay, caller, thank you. Thank you so much.
Dr. Martin, you go first on this one, and then I'll...
We'll be short on time, so 30 seconds.
I think the situation has been illuminated well. The caller, articulated the situation very well in terms of,
I'll say something on that, is that you have regular callers to your programs. And being a regular caller, it's something that I think is a wonderful thing in Grenada, or freedom of speech or democracy, and calling in and there are certain individuals who are in tune to all of our social issues and all of our current affairs, and will call in and comment.
Yeah.
But the fact that you're a regular caller does not make you a medical expert. And the fact that you can read a Facebook page on numbers does not give you the right to call in on a national program and start to quote some figures as though they were facts.
I mean, listen, yes, there's freedom of responsibility, but that freedom of expression, but that comes with responsibility.
Yes, it does.
Right? So that is clear there. All right, let me ask both of you this, right? Let's be hypothetical now, because there are a lot of realities in this world and possibilities as well. In the event, yes, that's the big one. In the event, God forbid, in the event it hits Grenada, would Grenada be ready to handle this?
Well, I'll open the batting on this one, because I'm going to speak purely from a clinical standpoint, and then, of course, Minister will speak from because of what I know of the virus, because I know of the pathology, and I know how the virus behave. I know for sure that it's a mild illness for more than 80% of the cases. So in other words, treating corona would be similar, if not the same, to how we treat the cold right now. It's as simple as this. You get the cold, you get over it. Most people who get the cold get over it. So that fact does not frighten me, because we'll be able to handle most of the cases. What worries me is the age group that seems to be succumbing to the disease. It seems to be adults or elderly people with comorbid conditions who already have chronic diseases going on, hypertension, diabetes, asthma, chronic COPD or chronic obstructive pulmonary disease or congestive heart failure. Those are the persons that I would focus on. And this is the part that's going to worry us a lot, because the data seems to suggest that the burden on the healthcare system seems to be around between 15 and 18%. So we do expect quite a number of persons in that age group to become sick enough to actually be hospitalized if that's the case. So going forward in our preparedness, we're focusing on that group, helping people to make sure that they stay on the medication, that they stay healthy as possible, eat well, sleep enough, drink enough water, so that in the event that it happens, we will be able to deal with it. My last statement is, the studies that are ongoing now regarding treatment in China and other places is a trial of a drug called Calitra. It is quite possible that that drug may be effective against coronavirus. We're looking at that research very carefully, because if it is possible that Calitra can actually treat the disease, we actually do have Calitra on the island in sufficient amounts.
I think you need to let the public know, when you say sufficient amounts, how many? A ballpark figure.
Around 6,000 to 7,000 tablets.
Right.
Yeah, so that should be able to treat quite a number of persons.
Do you have an estimate relative to about how much it will cost to treat a patient?
Oh, well, that's a bigger question, because we really don't have a health accounts in Grenada, so it's difficult to be able to tell how much it is to treat a patient. Grenadians, we're still in the modus of free healthcare. No one counts how many things cost.
Okay, all right.
What I would say with this is that I want to be cautious and specific here. We are not trying to trivialize this. It is a serious issue. We, like all of the CARAPHA and most other countries in the rest of the world that haven't had a case as yet, have no desire to see it enter our borders, and will do everything possible to prevent it from coming in. But if it does, it is not different from other viruses that we have dealt with. It is new. And that is why we are concerned and we are worried and we are diligent and don't want it to enter, because it is new. But based on its cases, and again, I will also reinforce what Dr. Martin has said, because we see that this particular version of the coronavirus has placed certain identifiable individuals in our society at higher risk. All the more reason why we don't want it here. And we want to make sure that we will do everything possible to prevent it from coming here. But if this disease breaks out of China and gets into the US or to the UK, then yes, it will come here. if it breaks out into the UK or the US, it will come here. The risk of it coming here directly from China is, as Dr. St. John has said, low, if at all. There is no way that an individual can come to Grenada without passing through one of the major ports. Even the disinformation that was occurring at the end of January about a flight coming direct from Beijing, no, it was not. We were being totally transparent. That flight stopped in Europe. The individuals were checked in Europe the same way that individuals would have taken a British Airways from Beijing on that same day and gone to Heathrow and be checked, and then gotten on a British Airways from Gatwick to come to Grenada.
Right.
But we saw it, the fact that these individuals we knew came, and at that point, Beijing, of a population of 21 million, had 8 cases. Toronto, population of 8 million, had 3 or 4 cases at that point. Toronto was a bigger risk to us. The city of Toronto, flights coming from Toronto were a bigger risk to us at that point than flights coming from Beijing. That's why we need to put things into perspective, and that's why we're monitoring it based on the cities. That's why people still scientifically are saying it's a Wuhan virus. If you have a travel history of coming from Wuhan, most definitely we see you as a high risk.
Okay, we have to leave things there for the time being, but just briefly, just a little bit, 15 seconds now, Minister Steele. The Chinese flight that came into Grenada, the chartered flight, was any of the passengers placed under observation?
They were all placed under observation.
All of them?
All were placed under observation.
And of course, the
that
fact
flight left and has gone on to other places in the world, and continued. Those individuals have moved on. 14 days have passed since that flight came. There's no risk. Right. We analyzed it appropriately. But as I say again, certain people took pleasure in forwarding temper tantrums and outbreaks on social media to imply that we had dropped the ball. Okay. We met that flight with our full team the same way we are meeting all flights now with our full team. We went an extra distance on that flight, even though that flight came in at 3 o'clock in the morning.
Okay.
We met them, and the reason that flight came in at 3 o'clock in the morning is because for them to get the proper medical clearance out of Beijing, they had to leave Beijing within a certain time, which meant travel time, stopping in Europe as well, to be checked, and to get here. That's when they got here.
So that was not a straight flight?
No.
That was not a straight flight?
No, those individuals got off in Montenegro, were checked based on European standards, EU standards, were checked the same way they would have been checked had they been on a British Airways traveling through Gatwick or Heathrow.
Right. Just briefly, I must ask this. Relative to the Chinese embassy here, of course, the officials are in and out of the island. What is your approach to handling that aspect of it?
Again, Kenroy, this disease does not pick out people of certain nationalities. My heart goes out to our colleagues here who are at the embassy, who have family in China, maybe in Wuhan or so. But the fact that they are Chinese does not mean that they're carrying the virus. And we have to be very particular on this. And I really want to stress on this.
But the fact that
this has, are we going to turn around and then say tomorrow morning, if it breaks out in the US that, or anywhere else, that we're going to pick on our ambassadors from those countries? No. Our Chinese embassy here is working overtime to try and dispel all of the negatives as well.
But I get that, Minister.
They didn't go home for their New Year's holiday. No, they didn't travel home because their country has made all of these extra efforts. Their country has locked down an entire province. So most definitely their country is going above and beyond.
So they have not been traveling?
No, they have not been traveling. They have not been traveling. But what we need to make sure of is, as a people, if we see them on a plane coming in on a Liat and they go from Grenada to Barbados.
I agree.
They've gone from Grenada to Barbados.
I agree with that, totally.
We need to recognize the difference between the science and certain people's prejudice. And we cannot identify a race or a nationality and pick on them in this instance, because again I stress, the last time we had one in 2009, it was in the United States.
Okay. Okay. Closing comments, Dr. Martin?
I always close by saying coronavirus, the prevention of coronavirus is one of the easiest things that I've seen in life. And so for so many diseases of public health implications, it has to do with cleanliness. Just simply keeping yourself clean, cough hygiene, wash your hands often, that would keep you away from coronavirus. Even if someone has it in the room and you keep yourself clean and wash your hands and cough hygiene, you're going to prevent yourself from getting coronavirus. And in a similar manner, to prevent other types of viruses like chickpea, all the other flavivirus, keep your surroundings clean, keep them away from mosquitoes. So first of all, keep yourself clean, and second of all, keep your environment clean.
Okay. All right. Well, gentlemen, thank you.
Kenroy, I just want to thank you and GBN for having us here this evening so that we can present information. And I know we've been allowed to, and GBN has facilitated us numerous times during the week in the morning programs, etc. And I think this is how we will fight the coronavirus. Right now, the biggest threat is information or disinformation, and allow us the opportunity on all of the various programs here. So I commend you and the management for allowing us that opportunity, and all of the other media houses that have been cooperating. And it is to fight the disinformation. And from that is the education and letting people know what the facts are so that we can be properly prepared and to stop the public hysteria that some people are preying upon and using it to increase the popularity of their blogs or their various social media programs and so, and jumping on the bandwagon and fear-mongering. Rely on the established international entities, the World Health Organization, Pan American Health Organization, CARAPHA, and the Ministry of Health in Grenada and Ministry of Health in all of the other islands.
All right, gentlemen, thank you so very much. Health Minister Nickolas Steele and Acting Chief Medical Officer Dr. Francis Martin. And of course, earlier we were joined via Skype, Dr. Joy St. John, Executive Director of the Caribbean Public Health Agency, CARAPHA. That agency, of course, is based in Trinidad and Tobago. Gentlemen, thank you so much. All the best. Yes, thanks very much.